So now I'm going to speak to Reena Wadia, who will give her clinical input on managing dentine hypersensitivity from the standpoint of a perio referral clinic. Reena, what is the prevalence of dentine hypersensitivity in a perio practice?
Well, I think generally, I think there's quite a huge variation in the prevalence of dentine hypersensitivity in the literature, but it is a significant percentage across all age groups. We do know that. In a perio practice, as you would imagine, it's much more, and I would estimate at least 50% of our patients suffer from dentine hypersensitivity, and this might be at presentation due to the actual periodontitis itself, or it can also occur after treatment as well. And I guess an interesting point here is how many patients actually speak up and say they suffer from sensitivity. And often patients just think, they have to live with it. So it's actually, I think at this point to establish, it's really important to ask our patients, do you suffer from sensitivity? So we can actually do everything we can to help them.
And dentine hypersensitivity can be one of the consequences, of course, of perio treatment.
Yeah.
How do you manage this challenge with your team and referring dentists?
Well, I think firstly, managing patient expectations is key. Periodontal treatment is very predictable, but some of the consequences, such as sensitivity and even things like gingival recession, they can be quite alarming to our patients, especially if they're unexpected. So it's super important to ensure patients are firstly made aware of the fact that sensitivity can occur following periodontal treatment. And this should be a key discussion point during our consent process pre-treatment, not after, but pre-treatment. And however, from a dental professional's point of view, I think it's important we try and tackle this from the outset. So we also need to reassure patients that, yes, it might occur, but we're going to do everything we can to minimize it and ideally eliminate any issues. And we take a team approach when managing this. So all the hygienists in the practice are aware of their role. I also liaise with the referring clinicians, so they're aware of their long-term role in managing the condition, because that's really important as well. So it's quite clear, managing sensitivity, it's a joint effort that includes your patient, your in-house team, and then also the referring clinicians as well.
Yeah. Very true. And you speak about working obviously with your whole team in managing dentine hypersensitivity and communicating with the referring dentist.
Yeah.
What advice would you give to other clinicians treating and maintaining perio patients who also suffer from dentine hypersensitivity?
Yeah, I think you've got to look at it like we're working as a team with the patient and the referrer and the clinicians. It's got to be 360. So don't just focus on, I just need to treat the dentine hypersensitivity, focus on one thing, think of it 360. So first, for example, you want to take a thorough history. You need to know what might be exacerbating that dentine hypersensitivity. Is it an erosive diet? Is it, gastric reflux? All those things need to be addressed as well. And that might include medical management as well. You need to try and manage it actively, commencing with actual advice on home care products, as well as in-house agents as well. So I think it's useful to look at 360, but then also a step-by-step approach. And patient-reported outcomes are just as important as clinical outcomes. So although it's very, in a perio practice, we're so focused on improving probing depth and reducing bleeding, I think things like that matter to patients, like patient-reported outcomes, like dentine hypersensitivity, is just as important in the current day and age.
I couldn't agree more. What is your current treatment protocol in-house for managing dentine hypersensitivity? And how do you manage sensitivity associated with perio treatment?
So I think the first thing is we ensure that home care is optimal, and patients are using a toothpaste that will actually help with sensitivity, and basic advice. We shouldn't underestimate the importance of basic advice, like spitting, not rinsing. We've got to emphasize that and can't assume that all patients know that. So that's the first thing. If sensitivity is due to or is exacerbated by other factors such as an acidic diet or gastric reflux or perhaps power function, then this also needs to be addressed. So we often give diet advice. Sometimes we ask our patients to see their GP if they're suffering from things like reflux, or we sometimes ask referring dentists to make a mouth guard if there's any signs of power function. So that's the kind of step-by-step approach. When we're doing the treatment, we use the EMS piezo, which allows us to use the warm water, which makes quite a big difference for sensitivity patients, especially if we're doing maintenance or supportive care, where we're not usually providing LA. that warm water makes a big difference. Again, for maintenance, I found that rubbing on prophy paste onto the tooth surface can really help as well. And for treatment, of course, when we're doing root surface debridement or subgingival PMPR, then we do numb up, and currently in the practice we're using the wand for local anesthesia. And then at the end of each appointment, regardless of whether it's maintenance, regardless of whether it's treatment, we always apply BioMin paste. And patients we found are quite keen on the melon flavored, which has been quite popular so far. But the reason why this is completed following any type of treatment is the pellicle layer is removed during treatment. So by applying BioMin, we're essentially occluding the tubules post-treatment. And so far, we've had fantastic feedback from all of our patients. If there's an allergy to SLS, then we use a high fluoride foam, sort of foam in some trays, and we use that at the end of the appointment. But some sort of treatment for the sensitivity is really important. And then all of these treatments, like the BioMin, it's applied mid-treatment as well. So we see our patients mid-treatment, and then also at the follow-ups, we apply as needed. And that sort of protocol tends to work really well for us.
And you speak about BioMin F. What advantage do you find from applying the BioMin F for kids after perio treatment? And do you choose BioMin F for kids because of the mild melon flavor rather than the mint of the standard adult BioMin F toothpaste? And do you find that patients find this more acceptable?
Yeah, I mean, I think it significantly helps with sensitivity from what we've found so far. And patients really do feel like you're taking that extra step as well, not just saying if you get sensitivity, use this toothpaste, you're actually in-house taking that extra step, and they notice that as well. We have actually got the melon, we've got the mint one as well. Sometimes we offer patients a choice, but it tends to be more because of the flavor. People quite like the melon, it's quite refreshing, so it seems to be really popular amongst our patient group at least.
And from your experience as well, what types of perio cases with dentine hypersensitivity involvement are the most challenging?
Most challenging, I guess, treating those groups of patients who already have significant dentine hypersensitivity to start off with, even before you've commenced treatment. They're definitely the most challenging group. That sensitivity is likely to be due to periodontitis and root exposure, and we're seeing severe cases in our clinic. So that with treatment it's going to get worse. So it's really important you ensure you're armed with all the tools you need to ensure you're actually minimizing this, and in fact doing everything you can to help reduce it. So they, I would say, are the most challenging cohort that we have to deal with in terms of dentine hypersensitivity.
And for other clinicians watching, for those particularly challenging patients, they generally can be more phobic, can't they?
Yes, because they've had a bad experience in the past, jumping in the chair and things are hurting or sensitive, so they can be phobic. So I think we have to also think about how to manage anxious patients as well at the same time, and again, a stepwise approach, showing them exactly what you're doing, making them as calm as possible, and making them, showing them that they can trust you as well, so giving them a good experience so that they are wanting to come back. We've had quite a few patients who initially they're too scared to even sit in the chair, and now they literally can't wait to come and see us. So that they're generally the most satisfying group to treat as well, to be honest, because you see that change in them, which is lovely.
Yeah, it's so rewarding cases that inherently, I've had patients in the past myself that have been so hypersensitive and they are so phobic. What would be your top tips for those particular patients?
My kind of top tip is, as I mentioned, just always give the patient a good experience. The last thing you want to do is they're in severe pain and they don't come back again. If that means for the first few appointments, whilst you're getting it under control, you have to numb them up. The main thing is that they have to be comfortable in your appointments, and then you can start dealing with the sensitivity and the reasons why they've got the sensitivity in different ways. The last thing we want to do is give our patients a horrible experience, they don't come back, their mouth deteriorates, and then they're even more scared of going to the dentist and have an even worse experience. So I think for me, I've always found that the best thing is find out, make sure they're comfortable, and then make sure you find out why they're getting the sensitivity and what you can do to help them, and explain what you're doing. Like, say I'm saying, for example, I'm advising a low acidic diet because I think that will help with your sensitivity. And I find when you're not just focusing on the mouth, like you're not just focusing on the teeth, and you're thinking about things like diet, the patients do quite like it because you're taking that extra step, because we at the end of the day, we're healthcare professionals, and we need to look at it as a whole, not just focus on that tooth.
Yeah. Just out of interest, Reena, have you ever worked with other physicians outside of dentistry in managing dentine hypersensitivity, such as dietitians?
I haven't yet, but it's definitely something I'm looking at, especially because of the links between nutrition and perio as well. So I think there is a sort of role of nutritionists and dietitians in periodontal or any dental care as such. I have referred quite a few patients to GPs to look at gastric reflux and medications for that, especially if it's uncontrolled. So I have looked at working at other professionals in that way, but I think there is a role perhaps for a dietitian or nutrition in this as well.
Yeah. Watch this space.
Watch the space.
Thank you so much, Reena.
You're very welcome.